Hello, and welcome to a special edition of Up Close on METV. I'm Charles Clapsaddle, station manager for Manatee Educational Television, and it's my great pleasure to welcome back to Up Close Dr. Richard Connor and guest with him, Poppy Green from Remote Area Medical. Dr. Connor, I want to thank you very much for taking the time out of your busy schedule to come and talk about this very important program.
Thank you, Charles. This, as you know, is our fourth annual go through again of this, what we feel to be a very, very impactful program for our medically underserved and our medically indigent patients in this area. And
we want to welcome Poppy to this because, Poppy, you're with the corporate RAM, is that correct?
Yes,
Out
sir.
of Tennessee. And you've been here from the very beginning as well, 4 years.
Yes, I have. I was actually a general support volunteer at the first clinic, and since the first event, I've come on full-time staff at headquarters.
Well, I must tell you, and I want to express, this community's appreciation to both of you for the effort that has gone into making remote area medical such a vital part of this community. The first year, you had hundreds and hundreds of people that came to it. It grew. The next year, it even grew more. And I think last year, you even added in a veterinary component as well. So we're going to talk all about all of that. But if I may, Dr. Connor and Poppy, please jump in if you could. Give us the big overview about what remote area medical is.
Sure.
And its importance.
yes, I became familiar with remote area medical back in mid to late 2014 and came to realize this is the largest charitable organization in America that brings free health care clinics to communities when invited. And the stress is on medical, dental, and visual services. And as I say, it serves the medically underserved and the medically indigent. In each of our 3 years so far, we've basically seen right at 1,000 people. RAM will be bringing a huge semi-truck that builds glasses custom-wise, and we will, if we follow years past, give out between 400 and 450 pairs of prescription glasses. As I say, treating right at or maybe a little more than 1,000 people, and delivering in the neighborhood of $500,000 to $600,000 of services and product.
Well, one of the key things, to me this is such a vital part of what RAM does, is that people line up very early in the morning, 2, 3 o'clock in the morning. Tickets are provided for each one. There's no money that changes hands. You have no insurance. You don't have to have ID. This is free medical services provided to those in need. And the wide variety of doctors, dentists, optometrists, volunteers, nurses, physicians assistants that are all there providing their service for these people that are in need. It's a remarkable achievement.
Well,
and Poppy, I would say to you as the clinic supervisor on the day of, there's a lot of coordination that goes into something like this.
Absolutely. However, we have great partners here on the ground with Dr. Connard and the whole community host group, as well as all the sponsors who make this event happen. So it is my honor to come here and work with them to help serve the people of Manatee County.
And we'll talk a little bit about volunteers and sponsors, but it's so well organized. And it's kind of a precise type of thing. People come, they get checked in, they get their triage, they're kind of directed to what specific area they're looking for, whether it's a medical. You have a huge dental area there, you have vision, you have a wide variety of services and resources that are available. And before we go too far, I want Dr. Connor to talk a little bit about MTC, the Manatee Technical College, and what a great space and area it is for remote area medical to use.
Yeah, we really are blessed in this community to have literally a world-class technical college here. It's been in existence as one of the first technical schools in the state of Florida in the early 1960s. And as of March of 2013, we've completed nearly $80 million of improvement in our facilities, equipment and furnishings, to where we now have got about 53 or 54 areas of excellence that people can come to for an educational program.
I mean, it's a great school, and one of the great things about partnering with MTC is that they have such vast space. Everything's kind of spread out. You have a dental area in the hallway. You have a vision area in the back. It's really, and Poppy, this is probably up your area as well. Is that there's such a lot of preparation that has to go in. The dental area alone, of which many people, require dental services. I mean, it's laid out precisely. You've got dental people, you've got hygienists. It's a wonderful sense of organization that goes into that, just preparing the dental area.
Yeah, and just earlier today, we were on site actually reviewing the layout and going over all the technical aspects and what it's going to look like day of to turn that great open space into a full functioning dental, medical, and vision clinic. Can't say enough about what a beautiful venue it is. It's well lit, it's very well maintained, great parking, everything you can ask for in a facility is provided to us right there at MTC.
And I want to talk a little bit about the dates, because you've moved the dates up a little bit for this year. And your first date is coming up in October, the 13th, and the hours are going to be from 6 a.m., you open the doors, to 4 p.m. But there's a lot that goes on before then, because you actually have people waiting to have a ticket for entrance. Is that correct?
Yeah, that's correct. This is a first-come, first-served type of a program. And there are people who have been waiting months, if not in some cases for years, to receive the care that we're going to be making available for them. And if you look at even our own county of Manatee, we've got upwards to 43% of our population that are in that gap where they are totally underserved or not served whatsoever. And if you look at a single mom, that goes up to like 80%. Wow. So we've got a vulnerable community, and it's expanding. And this is a way that the providers and the venue and the sponsors and all can give back to the community in the form of caring for these people.
And it's a remarkable combination of, because the sponsors help you with some of the costs that you go riding. You've got the experts, the professionals from RAM coming together. Yeah. You have a wonderful group of volunteers that help, from everything from signing people in to helping people with their medical needs. But you also have some great medical professionals that are volunteering their time to help. And if you could, talk a little bit about that, Poppy, if you could, because you've got dentists, doctors, physicians. I think even you were doing, at one time, you were doing x-rays at one time.
Yeah, so we are totally dependent upon those volunteer medical professionals. On the dental side, we're looking at dentists, oral surgeons, hygienists, dental assistants. On the medical side, of course, we're looking for physicians as well as all those different specialties, so that we can really treat whatever needs may emerge during the course of the day. And then on the vision side, it's optometrists, ophthalmologists, opticians. So there's a wide variety of professionals that render service. And that's not even considering all of the nurses that are there as well, supporting in multiple roles. Nurses at our clinics, they'll wear multiple different hats, from welcoming the patients and getting their medical history to actually being back there with the physicians rendering care.
It's remarkable. I mean, it's choreographed so well. I mean, people are very understanding. There's great crowds. People wait very politely. They wait for their turn. And your physicians and medical professionals are working efficiently and effectively to try to do the best. If I may, we've been very fortunate to be asked to record some of this. We saw one little girl get a pair of glasses, and she never had a pair of glasses before. And you could just see the joy in her face that she was able to see things. And that was a remarkable, and that's just one of the many remarkable achievements that you accomplish each time you do a
The one that I remember so well, Charles, was a little boy who was in 6th grade, and had not been able to have a pair of glasses for the previous 3 years. His had broken, and when he got those glasses, he just was ecstatic, and that kind of filled the whole room for a while with that sort of a thing.
But if you take those incidents, you multiply it by the hundreds and thousands of people that you serve, people that require severe dental care, people whose their blood pressure is too high, or whatever the case may be, you're serving this immediate, vast need, and I think that's a great achievement. But it's not enough that you're just doing it one day from 6 a.m. to 4 p.m. You're also coming back the following day on Sunday, which is the 14th, and you're starting all over at 6 a.m. again.
Right.
People will be, I'm sure, waiting, to get their ticket for access, and then you'll run all the way to noon on the Sunday.
Yeah, and actually noon is sort of the cutoff period for new patients, but when you look at the procedures that are taking place, this goes on into making a full day of Sunday out of completing all of that. And I want to be sure that we recognize that you're looking at, like you've already pointed out, between 500 and 600 professionals and lay people giving of their time and their talents. I mean, it's such a collaborative effort, and that holds true also of our sponsors. We don't take any government money, and there is no charge for it. These gracious firms and organizations make available all of the budget, which this year will run somewhere between $60,000 and $70,000. And for example, I was just over at Together Manatee, and they're making a $12,500 contribution.
A great
to
organization.
Yeah. Oh, what they do is marvelous. Great people.
These are much too numerous to mention, but this looks like a who's who of organizations, and a lot has to do with the reputation that RAM has, the success that they've had here, and as you, Dr. Conard, as well, because of the respect and admiration that people have for you in this community as well. But Poppy, I wanted to ask you, and you've seen this. You're a pretty young man here, a lot younger than Dr. Conard and I. One of the things that really impressed me, many things, is all the young people that come and volunteer. And it teaches them, the generosity of spirit. They're helping people, What do you say to young people if they want to perhaps volunteer and come and help you on the days of service?
Absolutely. I would encourage them to set their alarm clock early. They're long days. They're extremely rewarding, and I also give the warning that it is an addictive experience. You come to one event and you see, even though you may not have any medical background, how you can really transform the health of your neighbors, your friends, your community, especially for students who down the road they may want to go on to a professional school and become a dentist or a nurse. This is great hands-on experience where they can come and they can be a part of something bigger than themselves and give back to their community, work alongside professionals.
Aside from the care and attention that you're giving to the hundreds, thousands of people that have passed through the doors of MTC on those 2 days, you're instilling this sense of community into the people that are volunteering as well. And I have to also take hats off to the physicians, the medical professionals that come there. And people, I think we've interviewed people from Tampa. There was a doctor from Orlando that came one time and volunteered to come down, because the word of mouth is out there that remote area medical is going to be here and they're looking for physicians. How do you get that word out to physicians to participate?
So that's a combination of the community host group, again led by Dr. Conard, as well as that whole group. And at headquarters, we also help put the word out. We're from Tennessee, based in Rockford. We call ourselves the volunteer state. But down here in Florida, the volunteer spirit, it's alive, and it is well. And we are year over year blessed to have a great turnout of professional and general support volunteers that make it all happen. But we reach out through all sorts of avenues, everything from flyers going up in the supermarkets to speaking at local civic organizations, professional organizations. So we just try and get the word out there.
And we couldn't go on without paying a special recognition to the originator of remote area management, and that's Mr. Stan Brock, and who I understand is going through a little bit of an illness. But his dream and his vision of creating this so people can get medical care and the attention they deserve is a significant achievement, and he is to be recognized and celebrated for that.
You're absolutely right, and that was one of the reasons that I was so willing to put in the amount of time it takes, because Stan Brock is truly probably one of the most inspirational humanitarian type of individuals I've ever met. And you're right, this is a vision of how could he initially give back to the Amur Plain Indians in the, at that time, British Guiana, only to realize that that need is as great in the United States, and then focusing tremendous amount of resources and energy to do what he's done here. And this is, correct me if I'm wrong, but isn't this about the 35th, maybe 36th year that RAM has been functioning?
Yes.
All over the world and throughout the United States.
Yes, and over the course of those 3+ decades of work, we've had over 960 operations, treated over 700,000 individuals, over $115 million in free care. Those are all, conservative estimates out there.
And it's a remarkable achievement. And for those people who are unfamiliar with RAM, I would encourage them to, look it up, find out more about it, or perhaps, go to your website and get some background on it. Because I think once people understand the scope and the size and the mission of what you accomplish, it's overwhelming. What you've accomplished in those 3+ decades is remarkable.
It is. It truly is.
But I want to go back, if I may, just for a few minutes to the event itself. What time do you get there in the morning, Poppy?
I'll be there before 5 a.m.
So, and those people will already be lined up, ready to get their ticket. And as they come in, and they're welcomed, they sign in and they go through a bit of a triage. Tell us how that what they're looking for.
Basically, the only thing that they're asked is, where does it hurt and what can we do to be helpful to you? This is not invasive to any people. It's not dependent upon on any location where they live. They don't even have to give the location where they do live if they don't choose to. And so it's a non-invasive situation, and they then have the opportunity to go ahead and to choose whether they want medical, dental, or visual. And sometimes we'll even have extra time in some areas that they can get more than one service, or they can come back the next day and choose another service.
And whole families come too. There's mother, father, young people, children that'll come, and everyone has the opportunity to be seen, which I think is wonderful.
It is, and what we do with ours is we have what we call our community corridor. And that's where we have a lot of the organizations in our community that give services to families who are needy. And one that stands out particularly well to me is the collaborative effort between United Way and the Patterson Foundation. And
the grade level reading program is another perfect example.
They will give out between $12,000 and $15,000 worth of books to children who come through there. Some children who really have come through only as a part of their parents being seen still come to the event. And it's really gratifying to see that level of generosity and commitment on the part of the way those two organizations have put together their program.
And if I may say, Dr. Connard, again, I think you being the chair of the host committee here, you have that ability to bring people together, for the greater good. And I think as you get to your community corridor, and many of which are on your banner here, it's important for people to realize that, they just don't show up. You'll talk to them and say, we need your service, we need your help, and, they respond to you because of the admiration that they have for you and the mission that you're serving. We're kind of running down on time a little bit, and I want to kind of reinforce the fact that, this is 2 days in October, the October 13th from 6 a.m. to 4 p.m., and Sunday, October the 14th from 6 a.m. to noon. You don't have to bring any kind of proof of insurance. You don't have to bring proof of citizenship or insurance papers or any kind of thing. You will be seen.
Absolutely.
And people will just sign you in and direct you to where you need to go.
Yeah, you will. One of the contingencies that is always difficult for us is to be very certain that we have an adequate number of professionals. We find it especially challenging in the dental and the visual services. This year, what's really a nice expansion to visual is we've been working with the optometrist and the visual person who provide those services at, I just blanked on what the very large organization is.
The college?
No, the college will have students there and the supervision of it. Walmart is what I was trying to say. Walmart stepped forward this year.
Don't forget the name of Walmart.
Yeah,
You know, so-
right. Well, they stepped forward at a corporate level to help us coordinate with their visual people, and that was really going to be helpful to us in that area. And even the University of South Florida.
You have such a wide variety of people that are. You get the State College Florida people in the nursing program. You get those volunteers that come in.
And
you get people at USF. You get
Yep.
the dental people coming. But if I may, let me direct this towards you, Poppy. Is there a need right now? Do you need additional dentists or additional hygienists or additional doctors to volunteer their time? And if so, how can they get in touch with you?
Yeah, so right now we do currently need more dental providers, those being dentists, oral surgeons, and dental hygienists. We do also need additional vision providers, optometrists, ophthalmologists, opticians. And for more information, they can go to our website, which is ramusa.org. Yes.
And then there's also a phone number, too, which is an 865-579-1530, which I would think, there's plenty, in Manatee County is a very giving community. I would think that there's, a lot of medical professionals, either in the dental field, optometry, or, just in general medical, who, if they knew more about this program, would like to come and volunteer for a day or a half a day or whatever the circumstances are.
Absolutely, and it's a turnkey event. So those providers, you don't have to bring anything. You just come with your expertise and with a heart of service, and we have all of the equipment and consumables that are needed.
And I think that is, and it's remarkable how it's all laid out. You've got big trucks that roll in, as Dr. Conard said. You're making glasses on the spot there as the situation warrants. You've got a full-size gym-size dental area. You have private rooms for medical examinations. It's really a remarkable layout of how that things. And as the clinic coordinator, I'm sure you're looking at that every day saying, I need a little more space here, a little less here, and just trying to get everything set and ready.
Yeah, so we're always trying to improve the experience for both our patients, but also our volunteers. Without the volunteers, we can't do what we do. So we're constantly looking to improve. So hopefully to our return volunteers, if they come back, they'll notice some improvements. And any patients who have been at prior events, if they need more care, they'll come back and they'll see that we are working to provide an even better experience.
And I would say, too, that you probably do get a lot of return volunteers.
Yes.
Because once you get into the experience and find that sense of reward from helping people, you want to come back time and again and participate.
Yes, we have lots of return volunteers. It is addictive. It's a lot of fun. So I encourage everyone to come out and give it a shot, and you won't be disappointed.
I've had many of them, Charles, say to me that, basically they get as much out of this as the patients. Now, the patients are very appreciative and express that. But a lot of what is available there are to patients who really the private physicians don't prefer to have them in their clinics. We can service them much more effectively in this environment.
I got you.
So they're very rewarded, the professionals, and have expressed that numerous times. They say, hey, I'm getting more out of this than I'm giving, but as much as the patients.
Well, knowing several of the physicians and dentists that have participated in this over the last 3 years, you can see the joy, the excitement, and that sense of purpose that they bring to that event each and every year.
They truly do, yeah.
And I just want to go over a couple of things. Again, I want to emphasize the remote area medical health program is going to kick off Saturday, October 13th from 6 a.m. to 4 p.m. and on Sunday, October 14th from 6 a.m. to noon.
Right.
And people will come there, they get a ticket, and they're seen in the order that they participate.
Right.
Poppy is going to be working diligently between now and then, making sure that every physician and every dentist and everything is going to be there. And we would encourage people to give you a call, give your website a call, and if they want to help either as just a general volunteer or a medical volunteer.
Absolutely. So I know the website and phone number are listed, so go there for more
We
information.
got it up on the air right now, so we do it. And I would say to you, Poppy, congratulations on doing this. This is, for you, it's got to be a very rewarding type of thing, and having your energy and excitement as a young man, doing this. And how long you been doing this with RAM now?
Full time, 1.5 years.
Yeah, it's exciting.
Yes, it's busy, it's tiring work, but it's extremely rewarding, and I get to work with great community host groups and meet wonderful patients all around the country.
Well, we're gonna be looking for you because we'll be there on both of those days. We'll track you down and get a comment on from there. If you have time, I'm sure you're going to be very busy.
Of course, I'll make time for you all.
And I would also say, getting the opportunity to work with Dr. Connard, that's a lesson in itself. But and he's such a great guy, and he's kind of made this his mission for Manatee County, and we're very, very grateful for that. So, Dr. Connard, what do you want this community to know about the importance of remote area medical?
Well, I think the importance about remote area medical is that it's been created by a very inspirational humanitarian who literally has given his life to this, and that has spread into communities like our own. And in spreading into it, it's then spread to the providers. It's spread as a service to those who are underserved or medically indigent. And we will have out-of-state patients who hear of this and come because they can't get the services even in their own communities. And it's just a beautiful collaborative effort of a lot of organizations and a lot of providers and a lot of people in the in our area here to find a way to give back, but to give back in a way that truly is not only inspirational, but it does a lot of good for these people receiving these services.
And I couldn't agree with you more, Dr. Connard. You've done a remarkable, and hats off to both of you gentlemen, for the service that you provide, the effort that's out there each and every time that you come and set this up, for all the people that need it. But the gratitude, the medical services that your patients get is a wonderful reward. And I believe that everybody is very, very grateful for what you provide. Again, I'm going to repeat those dates. Saturday, October 13th, 6 a.m. to 4 p.m. and Sunday, October 14th from 6 a.m. to noon. Phone number is 865-579-1530, and the website, of course, is ramusa.org. Poppy, it was a pleasure to meet you, and keep up the good work, young man, and we'll look forward to seeing you on the dates. And Dr. Connard, what can I say? You truly have taken this on, and for the last 3 years have kind of carried the torch on this, and Manatee County is very grateful without a doubt, and I would just say keep up the good work, sir.
Well, and it can't go without saying the important role that you play here, helping us get the word out, helping us basically be able to historically have a place to go to realize these
And I think it's
functions.
important to archive this too.
Yeah.
I think it's important to archive the
that,
service and document the service that RAM continues to provide. And we're just very happy and very proud to be a very, very, very small part of it.
Yeah.
Dr. Connard, Poppy Green, thank you for joining us, and thank you for joining us on this special edition of Up Close on METV. I would encourage those of you who'd like to volunteer, find out about RAM, go to their website, find out how you can help. And if you're an individual or a family out there that requires some medical attention or dental attention, make sure that you put those dates aside so you can participate in RAM at the Manatee Technical College October 13th and 14th. Again, special thanks to Dr. Richard Connard and Poppy Green for joining us from RAM, and thank you for joining us on this special edition of Up Close on METV.